happy to put it in a child, then I'm happy to have it done to my face.
Absolutely, very good point. Hi, I'm Dr. Bela, dermatologist and cosmetic doctor of the Hogarth Medi Spa in West London, and you are watching now the 5th episode of the Clinic Drive series. And I have here Sarah today, who has been so kind to me because she let me use her before-after images in my communication, and she agreed to drive with me today and talk about her filler and anti-wrinkle injections. So hi Sarah, welcome in the Clinic Drive series. And a little bit of history. So you came to me in December 2013, so almost 4 years ago.
Yeah.
And how do you remember that time? How did you find me, and what were you looking for? What kind of results you were looking for?
What the results I was looking for is I felt like I was getting eye bags underneath my eyes, and I've got a friend who works with you at the Medi Spa, and I was asking her to recommend anybody that could help me with this, as in anti-wrinkle injections. I wasn't 100% sure about fillers back then, because it always frightened me that some of the stars, they look a bit too much with having too much fillers. But when I spoke to Kelly, she reassured me that you was the person that I needed to come and see. So first meeting I had with you, I actually had a mole check. That was one of the reasons why I did come, is I had a mole check because there was a mole I was worried about. So we did that first, and then we had a consultation, and then you advised me that your face, as well as going down, goes in a little bit, and that's why it seems your eye bags are more prominent, but they probably always have been there. So you advised me, by having just a small amount of fillers here, which is not very much at all, that would lift my face slightly, and the Botox around here was my crow's feet that I was more worried about. My crow's feet would it would help sort of not solve the problem, but make them not so obvious, and a little bit of in my forehead. But I still like to have movement when I'm talking. I don't like frozen. I think because you can be quite expressionable with your face, and I don't want it to look stiff.
Absolutely.
Yeah.
So we can see your before picture on the screen now. So this is the image that I took the very first time when you came to me, and we can see the normal signs of aging here. So nothing to do with skincare or sun protection, because in this case we are talking about the superficial fat pads beneath the skin, and as we age they shrink and they disappear, and as you said, the skin collapses and sags south. And with fillers along the cheeks mainly, because cheeks are the backbone of the face, so they support the upper face and they lift the lower face. So with a little bit of fillers along the cheeks, we can give projection, and we can achieve, it's called a liquid facelift. And which is an amazing thing for me after so many years is altogether during the 4 years we have put 7 syringes of fillers into your face. And if you visualize a teaspoon is 5 ml, which is 5 syringes.
It's not a lot.
So we just put a little bit more than a teaspoon, and you can see the beautiful results. You can see the after pictures, or the before after pictures side by side, and you can see how the cheeks improved, and through the improvement of the cheeks, how the under eye area improved as well. And obviously due to the anti-wrinkle injections, the upper face, the forehead looks better as well.
Going back to what you were saying earlier about the age, I forgot to say, I think I was probably getting late 30s that you start thinking about this type of thing. And actually what I was going to say, the one thing that did worry me about the anti-wrinkle injections was what you're putting into your body. Now I have a little girl, which I've told you about, who's got cerebral palsy, and she has Botox put in her legs, and she started having that done at 6 years old. So if they could do that to my 6-year-old daughter, that was another turning point for me. It was a light bulb that I thought, well, then I'm going to have it done
Very
as well.
interesting. Yeah.
Because it's used for lots of reasons in medical terms, you know, for underarms. But like I say, to put it in a child, if they're happy to put it in a child, then I'm happy to have it done to my face.
Absolutely, very valid, very good point.
And again, I think even over the time, I think you've improved in the 4 years that I've come. As in, to start with, I had a bit of filler down in the eye trough, but we don't do that no more. It's just a very small amount, all here. So, you know, the results are amazing, and I think the look you get with my husband, he knows that I have it done. He's not always sure when I have it done, but he will come home and say, "Oh, you look fresher today. You look fresher." And I think the only way you can describe it is it's like being able to wear no makeup again when you were younger. So wouldn't want everyone to look at me and think, "Oh, she's what she had done to her face." There's no way that's what I would want, how I'd want to advertise it. Even for you, I wouldn't want that. I think you've just got to look fresher in the face, and that's it.
And when you finally came, for how long time you had been thinking about coming and finding someone to have your face improved?
Well, probably about a year, but it's not the sort of thing like you say you talk about. You don't say to someone, "Oh, do you have Botox?" Where do you go? It really isn't the sort of thing that you talk about. So, and like you say, everyone tends to keep it a bit of a secret. So it was really, like I say, my friend. I've known Kelly all my life, and I asked her about it because I know you can trust her, and I know she works in reputable sort of place to have it done as well. Because that's the other thing. I'm sure you can get it done anywhere, but how do you know? You don't want an eyebrow frozen up here. You know, you really have got to trust who you're working with.
Can you talk a little bit about the procedure itself? How the discomfort level, the time it takes, and
it doesn't take very long. That's one thing. It doesn't take very long, but as in pain, you wouldn't call it pain. It's not painful. It's just a little bit of discomfort while it's being done. But you don't actually feel anything going into your skin. It's a needle basically, so it's only like having a little small injection. And as regards for after, I do find, but I've got quite sensitive skin anyway, I do find that it's tender, and I feel I wouldn't have it done if I was going on a big night out. I'd have it done a couple of weeks before then, just in case you do get a slight mark, or and it just feels tender. And I expect, how I feel is I'm going to look in the mirror and it's going to look bruised or swollen, but it doesn't look like that at all.
That's very good. And have you had any complications or anything after that? Any treatment?
No, that's the only thing I would say. Is just afterwards, I wouldn't have it done. I always plan when I'm going to do it, so that I think, what have I got coming up these next couple of weekends? Nothing. Then I will have it done then for the occasion, i.e. Christmas, or And it's a couple of times. Well, only a couple of times a year, really. Possibly 3. But the fillers is twice a year, and I'd rather have less each time I come than have too much so that it lasts.
Yeah, natural look is very
natural,
important. Yeah,
very
absolutely.
important. I've never been one to wear a lot of makeup and always having my nails done. That isn't really how I work. But this, I just feel, for me, I'd rather, nowadays I think the industry's moved on. I used to work in the industry, and it's moved on so much since I was there. It was a lot more about relaxation when I was working it. Now it is people want results. They do want instant results, and that is what you get with fillers and anti-wrinkle injections. People want results, whereas if you're going to book a course of something, you have to wait. But this is instant.
Did you have any reservations before coming about safety and efficacy of filler or anti-wrinkle injections?
I think that goes back to when they said my daughter could have it in her legs. My reservation was, what am you putting in your body? But when I was advised that she can have Botox every 9 months, that squashed that reservation.
Yeah. And what do you think about that? Is it pure vanity having these treatments, or through the improvement you feel better, you feel more confident, so overall it improves your whole quality of life?
There's obviously a certain amount of vanity involved in having something like that done. But I think for me, I suppose it's like when you've, I don't know, had a shower and washed your hair, and you know, you can face things better, can't you? So it does give you confidence that you're not trying to hide your face or worry. You know, it's different now to what it used to be many years ago. People did probably grow old a lot more gracefully, but now we can have these small, it's not like having a facelift, which is very invasive. These are very small things that you're having done that make a huge difference. Make a huge difference to your face, how you feel. Like I say, I'd rather have this than have my nails done.
Yeah, absolutely, that's amazing. And as a kind of a summary, what would be your message to those women and men who are looking or thinking about these treatments but haven't found the courage to phone a clinic and book a consultation?
I'd say get on the phone to you right now and Google your number and phone up and just come and see you. Just come and see you. Don't, you know, you haven't got to have it done. You're only going to advise where and what you would do. You don't have to have fillers. You don't have to have the anti-wrinkle injections, one or the other. You know, try one first and then combine the pair. You know, just come and see and be advised. I think you'd be amazed by this, how, you know, like I say, it's only twice a year, how much little time it takes and the results that you get for the fresh look. It's just a fresh look, that's all it is. It's just a look that you haven't got your, you know, when you haven't got your makeup on. It's amazing. I would go out without makeup on now.
Which is very, very good. So I have for this reason I have a free aesthetic consultation, which is really no obligation, 15-minute consultation about what kind of improvements can be achieved through dermal fillers or anti-wrinkle injections. So anybody can book, and I listen to the patient's thoughts, what she or he would like to be improved on her face, and I examine the face and I come up with a treatment plan. We talk about efficacy, safety, price, everything. So you leave after this 15-minute free consultation with quite a bit of a knowledge, so you are equipped to make a good decision about these treatments. So you are free to come, free to decide. So I would encourage everybody to book a free consultation and find out more during that. Thank you very much driving with me. If you have any questions about anything we have just talked about, you can reach me through my Facebook page, which is drbela.clinic. You can find more information about these treatments on my website as well, which is again www.drbela.clinic, or you can drop me an email at info@drbela.clinic. So thank you very much for your time and attention, and thank you as well, and see you at the next clinic drive. Bye bye.